Hi, my name is Rebecca Garrison. I'm a PA at Alpine Orthopedics. I'm here with Ashley today and we're going over some exercises after knee surgery. So we have our PT, Melissa, who's going to walk us through some knee extension.
Hey everybody, one of the exercises we want you to make sure you're focusing on at home is a prone extension. This is an important exercise because extension or straightening is our first priority after your knee surgery. So what I'm going to ask Ashley to do is lay on her tummy. And she's going to lay in a position where her knees are hanging off the table. This allows gravity and the weight of her leg to work on that knee extension or straightening. In some cases, if this feels a little bit too aggressive, you can always scoot your body onto the surface a little bit more. So now her knees are up on the table. But our ideal position is if she goes ahead and scooches back, we want those knees hanging off. If for any reason this is uncomfortable for your back, you can lay more flat. Or you can always take a pillow and tuck it under your tummy. That'll get you in a more neutral position here, which can be more comfortable for the upper part of your body while you're working on knee extension. An upgrade to this exercise, if this is her surgical leg, is to take her non-surgical leg, cross across the ankles, and push down. That's going to go ahead and allow her to create more extension or more straightening in this position. Now, we know that most of you don't have a treatment table like this at home. Ways you can mimic this at home would be a coffee table with a blanket or a yoga mat on it, dining room table with a soft surface laid on top. If those aren't available, your bed is a great last resort. It's a little squishy, so you won't get quite as much extension, but would rather you do it there than not do it at all. So again, straightening or extension is our key focus right after knee surgery.
So Melissa, our physical therapist, is going to walk us through this important flexion exercise called a wall slide.
So after knee surgery, we are prioritizing knee bending. You have another series of exercises that are for knee straightening. We want to make sure you're doing those as well. These are your knee bending exercises or knee flexion. So the first one's called a wall slide. We're going to go ahead and have Ashley take her surgical leg up the wall. And she can also work on a little bit of extension here too, because as you can see, she's in a straightened position right now. The next goal is for her to slide that heel down. And we're going to work to at minimum 90 degrees. When she can start going beyond 90, we'll either have her scooch her body in to increase that flexion, or we can also have her take her other leg and put some overpressure on that knee. And as you can see, that achieves a lot more bending, a lot more flexion. When it's time for her to go back to extension, she can remove this leg, work on the strengthening component of sliding that leg up. So we're getting a benefit of some strength work and that flexion range of motion or bending range of motion. This is a really key exercise. Make sure you're helping out your therapist by working on this at home. This is your homework. Be a good student.
So Melissa, our physical therapist, is going to take us through some sitting knee flexion.
So this is an important exercise after surgery when we're working on restoring knee bending or knee flexion. Most of you come out of knee surgery with a brace on, maybe you're swollen, maybe that knee doesn't really want to bend. And so as a physical therapist, it's my goal to restore your straightening and your bending, as well as your function. This is an exercise that you can do at home. If you have a brace, you'll definitely take it off to do this exercise. We want you to work on bending the heel underneath that chair. There's a few ways to do that. If you're somebody that has a slippery floor at home, you can put a towel down in order to create better slide. If you don't have a slippery floor, if you're someone who has more like a carpeted floor, there's a few other ways you can work on it. You can use your other leg to help you. So if I get Ashley right there, she can use her non-surgical side to go ahead and work on that flexion. And then if she needs help coming back out, she can even use that leg to help bring her back out toward the extended position. So your other leg can be your buddy during this exercise. As you get a little bit further in that rehab process, you're getting better, things are feeling great, we want that leg to work on its own. So generally, we'll just use the other leg to work on the overpressure or working on improving your flexion. So we'll use this second leg or the non-surgical side to get her into more flexion. Then she'll remove that leg and make this guy work by kicking out to me, which actually also counts as a strength exercise. So the purpose of the chair slide is to work on knee flexion or bending. If you have any questions, you can always get in touch with us at Alpine Orthopedics.